One of the number one questions I get as a therapeutic horticulture practitioner is whether there's a difference between therapeutic horticulture and horticultural therapy. The quick answer to that question is yes, and we'll definitely get to that. But let's start with a professional comparison that's a little more mainstream to make it easier to understand. The differences between TH and HT are a lot like the differences between a personal trainer and a physical therapist. Both personal trainers and physical therapists work with their clients to develop personal goals and then customize a set of physical exercises and activities that empower them to reach those goals. They continually monitor their clients' progress over time so that they can adapt and adjust to the activities to meet the ongoing needs of their clients. So, the foundational elements of both professions are very similar. But where we start to see the real differences between the two is when you start to specify the types of goals the client is hoping to achieve. If someone's hoping to get stronger, healthier, and more confident in their body, a personal trainer may be the perfect fit because they're trained to motivate and help clients reach those generalized goals. Some personal trainers are educated in college level programs, and others may opt to do a professional certificate program that prepares them for the job. On the other hand, physical therapists have a much more clinical focus and regimented protocols. They're required to complete accredited college programs, do hands on internships, and have to pass a licensure exam to practice with clients. This advanced level of training allows them to address acute medical conditions and provide services that are often covered by insurance. Taking that same idea into the garden, therapeutic horticulture practitioners, like personal trainers and physical therapists, work with their participants to develop personal goals that center around personal health, social connection, and well being. Then they design plant or nature based activities that empower participants to achieve those goals, individually or in group settings. TH practitioners are trained through professional certificate programs, such as Root in Nature's. These programs equip students with everything they need to know to develop, facilitate, and manage TH programs with diverse populations and settings. Horticultural therapists, like physical therapists, complete accredited college level coursework, do a supervised internship, and apply for professional registration through a governing association. As a result, HTs often work in clinical treatment settings and address more acute or specific client goals. They essentially conduct the same type of nature based activities that you would in TH, but may interweave some deeper clinical elements and formally document client progress over time. It's important to note that no state or country currently requires registration to facilitate TH or HT, but holding a certificate or registration status in either significantly boosts your professional credibility, your ability to secure a job, and ability to provide ethical treatment, particularly in clinical environments. Both approaches are powerful and both are needed, but like apples and oranges, they're both fruit. Whichever one you choose simply depends on the flavor that you want. If you're fluctuating between whether TH or HT is the right path for you, you may want to ask yourself the following questions. What population do you want to work with? Do they tend to have acute, specific clinical needs? Or are their goals more generalized and centered on personal health and well being? Where do you hope to provide TH or HT? Does the setting require you to have HTR status, or is a TH certificate adequate? And finally, do you have the time, money, and ability to achieve HT registration status? Or do you feel like receiving specialized training in TH, paired with your existing knowledge and experience, is enough for you to feel confident to practice? One major reason why there are so few registered horticultural therapists worldwide is the cost, the time commitment, and the limited access. Fewer than 10 accredited HT programs exist globally, and finding an HTR to supervise the 480-hour internship is often a significant barrier, especially for working professionals. Root and Nature's Therapeutic Horticulture Certificate Program was created to address these barriers. While we deeply value and support those who are able to pursue HT registration, we offer an accessible, affordable, and robust alternative for folks who are more focused on community-based practice or integrating TH into an existing profession. Our students include allied health professionals like recreational, occupational, and physical therapists, as well as social workers, psychologists, educators, horticulturists, master gardeners, and volunteers. The strength of TH lies in the diversity of its practitioners. At Root and Nature, we walk shoulder to shoulder with our students, supporting their growth at every stage. We trust that you'll choose the path that aligns best with your goals, and we're here to grow with you.